Okay, so hello everyone, thanks for joining today for our Professional Beauty webinar. I'm just going to set up the live stream on our social channels, so I will be back with you very shortly. Right, that's just going through on Facebook, so we may be live. Just a couple of seconds, and I think we're live on Facebook. So hi everyone, hello, and thanks for joining us today for our Professional Beauty webinar. I'm Eve Oxbury, I'm editor of Professional Beauty, and today I'm joined by Jody Adele Taylor, who is the founder of Skin Deep Clinic in Doncaster, and was also Professional Beauty's Therapist of the Year 2017. So hi Jody.
Hi, how is everybody? I hope you're all well.
Everyone's good.
Excited, ready to go back to work now.
Oh yeah, absolutely. I mean, obviously, well, let's kick off with that really. We speaking earlier, the news broke yesterday that it's been confirmed that we're back on the 2nd of December. So that's, I think, good news all round for everyone based in England. Yep,
it will.
Fab. So today, Jodie's going to be talking about maximising results of microneedling within the HEE guidelines. So just for background, these are the guidelines that Health Education England drew up for the government and turned into a framework that recommended which level of training should be required to perform certain non-surgical aesthetic treatments, one of which was microneedling. And for microneedling, the level of training suggested varies depending on the needle depth being used. That framework was then picked up by the JCCP and turned into a set of education and training standards, which at the moment are not mandatory, but they are very much pushing to make them mandatory. So Jodie's going to be talking about that and about how therapists can achieve results from microneedling without using the longer needle depths necessarily. Okay, so if you have any questions for Jodie as we go along, if you're watching with us here in Zoom, then just type them into the chat box, which you should be able to see at the bottom of your screen. And if you're watching on Facebook, type them into the comments section and they'll get through to us to answer live.
I've just seen one come up there from Margaret. It is the 3rd will be the first day you can go back to work. 1 minute past midnight if you'd like to.
This is the confusion. We were told yesterday they changed this and it is now the 2nd, I believe. So we were all planning for the 3rd, but in the government winter plan that was published last night, they did say from the 2nd. And now some of the associations that I know had advised people the 3rd have now updated their advice to the 2nd as well. So pretty confident that that has now been updated, but it has been very confusing.
I'm starting back Saturday the 5th. I thought breathing room. Start on the 5th, because I knew this had happened, that they'd make an announcement, then guidelines had probably come out on the Friday, and maybe they were saying you can work but not facials. So I just thought, let's start on the 5th and take the month from there. So because it's always a little bit unknown really.
Exactly, yeah. And I think this time it has been rather confusing because, yeah, the government, from what we've read, the government guidance did say that work could start again from the 3rd, but they did update that yesterday to say the 2nd. So I know, particularly on our social channels, there's been a lot of chat about this, but pretty confident now that we are allowed to go back on the 2nd. So, Fab, so yeah, we're going to be chatting about microneedling. So whenever you're ready to share your screen, Jodie, I will turn off my video and we can get going. And I will pop back in at the end for any questions.
Can everybody see that clearly? I think you can because Eve's gone now. So, hi, I'm Jody Taylor, and today we will be going through in this session, reviewing our options really as therapists and how we can go about needling within these new proposed regulations. Yes, they're not mandatory at the moment, but if they are, we could all be sat with microneedling devices that we feel we might not be able to use effectively. So this session today is largely to show us a way that we can do transepidermal microneedling effectively for our clients. So generally, microneedling treatments are largely carried out to have a wound healing response, penetrating papillary dermis for collagen induction. And obviously, needling to a maximum depth of the proposed 0.5 millimeters is not going to create a pinprick bleed in all cases. So hopefully gone are the days of using topical local anesthetics applied pre-treatment, and then you would needle to a predetermined depth, either using a roller or an automated device to produce large droplets of blood, irrelevant of the treatment indication, whether that be acne, acne scarring, hyperpigmentation, melasma, cellular regeneration, or age management. So just picking a device and picking a 1 millimeter needle for any indication is not really needling for the indications that you see. Because remember, the skin is not linear, it is different depths all the way across the skin. So that being said, the mind shift following these years of practice may take some time. So this session's produced to concentrate mainly on age management, because I feel that's where our largest concerns will sit, and how to work as therapists within these new proposed guidelines, whilst following the science and clinical studies working to below a depth of 0.5 millimeter. And the guidelines will be for level 4 aesthetic therapists. So as I've said, today we'll look through microneedling and treating the following skin conditions. We'll look at aging and the dermal epidermal junction in relation to aging, pigmentation, the ingredients to promote treatment outcomes, and the time frames to work between treatments. So here we have a little quote from Dr. Lance Settersfield. He's an expert in the field of microneedling, and he says that cosmetic microneedling at a depth of less than 0.5 millimeters triggers a different regenerative pathway with very limited inflammation, injury to keratinocytes, upregulation of genes for the production of collagens types 3 and type 7 at the dermal epidermal junction. So the required academic accreditation put forward originally in 2014 by Health Education England, which has been taken over by the JCCP, as Eve discussed. So at level 4, therapists would be to deliver treatment at a depth of 0.5 millimeter face and 1 millimeter to the body. To work at a level 5, you would do 1 millimeter face and 1.5 millimeter body. Those working at level 6 or above will be subject to clinical oversight, and it's 1.5 millimeters face and 2 millimeters body. At the moment, 0.5 millimeter needling is classed as cosmetic needling. And for those needling at a depth of 0.5 to 2.5 is medical needling, and anything above that is classed as surgical needling. So as aesthetic therapists, we should be using cosmetic needling depths, especially when the regulations become mandatory. So the JCCP just put a little note in here that the HEE guidance has now been rescinded and replaced by the documents produced by the network of the JCCP. You can download this as a PDF document. You can download the 2014 HEE regulations also and have a look at those, to have a look at what the framework is. And it's got on there IPL, laser and chemical peeling. So the first point we'll look at is age management. and treating within the new guidelines to a depth of 0.5 mil. So treating this skin concern with no blood. There is ample evidence to show that keratinocytes do stimulate fibroblasts, and they will synthesize the growth factors, which in turn stimulate keratinocyte proliferation. So to understand this a little bit more, we need to look at the dermal epidermal junction, which I'm sure you've heard about. So we're just going to cover that a little bit and talk about how we can needle for age management. So first of all, we've got the epidermis, the upper 5 layers of the epidermis. Keratinocytes are the predominant cell within the epidermis. It's 80% of the cells are keratinocytes. The melanocytes reside there, as do Merkel cells and the Langerhans cells. And this then goes down into the dermal epidermal junction. It's a small area, which then the papillary dermis, dermal papilla, come into the dermal epidermal junction. And then the top fifth of the dermis is papillary dermis, and that's where the fibroblasts are and the blood vessels. So let's look at a cross section now under a microscope of the dermal epidermal junction, the DEJ. Here we can see in a young skin that nice mountainous range of the dermal epidermal junction, and then it compacting as you age. So that scaffolding's reducing and flattening out. And that's when you'd start to get more rhythids on the skin as the skin glycates. So that would be visible wrinkles. Here we have a cross section of the DEJ and everything that is in there. So I'm just going to tell you a little bit about this and why this area is so important and why it will become more important for aesthetic therapists working with chemical peels superficially and working at a depth of 0.5 millimeters with microneedling devices, and why it might not be so bad after all. So as you can see, the DEJ is situated between the basal layer of keratinocytes of the epidermis and dermis, and that helps keep the skin's structural integrity. The DEJ is comprised of hemidesmosomes, anchoring filaments, anchoring fibrils, type 7 collagen, which combine together to tether the dermis to the epidermis. At the DEJ, the dermal fibroblasts and epidermal keratinocytes do interact to form an interlinked basement membrane of extracellular matrix. The extracellular matrix is the area between the cells, and that's something we'd look at completely separately. So we'll stick to the DEJ for today. So targeting this area through your microneedling treatments does correct the loss of structural integrity. It will also increase the production of collagen type 4 and 7, whilst helping target types 1 and 3 to help restore that adhesion. So as I've shown before, as we age, this area here does flatten, leading to structural but functional changes as well associated with aging. Studies do confirm that it is the loss of this structural integrity at this junction that will cause wrinkles. So with you targeting with a depth of no more than 0.5 mil, combined with your targeted ingredients, will improve the skin, not only for aging concerns, but it will help with acne, and it will help with skin texture, and it will help with skin tone with hyperpigmentation issues as well. So the dermal epidermal junction does play a significant role, and there is no blood here, so you don't need to be targeting for blood. So when you are microneedling, as long as you are targeting the basal layer of the epidermis, you will cause erythema. You wouldn't necessarily get a pinprick bleed either. That being said, there's been many of occasions when I've been doing microneedling, because I never use topical local anesthetics, which will vasoconstrict a vessel, giving the skin a grey pallor, and it takes down and closes up the vessels in layman's terms. So When you're needling, it will produce a lot of blood. So you could be needling way through the epidermis, the DEJ, the dermis, and targeting an area in subcutaneous tissue where there's not really much collagen anyway. So I've been needling on foreheads at 0.25 millimeters, and there has been a pinprick bleed, which would indicate to me I'm below papillary dermis. So back to the DEJ. So as we can see here at the very bottom, we'll work from the bottom up. We can see an area called the lamina densa. And here above there is some anchor fibrils. And these project up from the papillary dermis. And these are all made up of collagen type 7. And what they're thought to do is loop up and back round. And the green band is of epidermal origin. And it's made up of a lattice of type collagen type 4. And this is a strength that's produced by keratinocytes and fibroblasts. The yellow band above there is made up of like anchoring filaments, and this is of laminin, and this will bind the cell surface, increasing the cell adhesion, which is highly important. So these little projections work up to some little studs along the top, the hemidesmosomes, and these are protein complexes, and these structures are found in the keratinocyte, and they're involved in signaling keratinocyte migration, connecting the basal cells to the lamina densa. Above there you have the tonofilaments. These are fibrous proteins synthesized by the ribosomes, and these form tonofibrils, which essentially is the keratinocyte. So you can see this when we read all this out, this like interlocking membrane that we need to keep firm. This area is also responsible for the exchange of oxygen, nutrients, and waste. Okay, so that is the DEJ and its function in brief. So if we can target this area, we will help with structural integrity, reducing wrinkles, reducing the hyperpigmentation, the rough texture that all occurs with chronological aging. So how do we target the DEJ and what are the benefits to that? So I've just put here, just to remind us, we're needling at 0.5. We're going to use targeted ingredients which combined together will help. So it plays a role in epidermal and dermal interactions, targeting the keratinocytes to promote cross-cell talk, regulating the melanocyte, so perfect for dealing with hyperpigmentation issues, and fibroblast function, which we all know stimulating fibroblasts will help produce this strengthened, toughened structural collagen. So it'll target gene expression at the dermal epidermal junction for the purpose of upregulation of collagen to restore structure and adhesion. Gene expression downregulates MMPs, the proteins, the inflammatory growth factors to play a preventative role in aging. So UV damage, for example, will regulate the MMPs to cause cell destruction. So targeting this area will downplay all that. It will act as a vehicle for cellular attachment, which we know is very important. And it will act as a gatekeeper for transit and as a moderator of cellular activities such as differentiation. So what would be new time frames? How would you be able to needle at this in this way for your client? So for transepidermal technique, you're going to use specific targeted ingredients, and you could do a series of 8 treatments 2 weeks apart. Remember, you're not stimulating blood, so there is no risk of granulation of tissue. Okay, and you're going to use products in synergy with the needling to get the results that you want to achieve for what you've done in the client consultation. You can combine microneedling at this depth with superficial peeling safely pre-treatment. So you would need peel and immediately microneedle. You could use LED. At this time, if you are going to be using microneedling in this way, you must always follow manufacturer's protocols. This is not a cherry picking exercise. This is not saying you're going to combine all these wonderful treatments and using this from there and picking around. It's a specific protocol, and there are companies out there, 3 of which I use, which will use peeling in combination in strict protocols for microneedling. And for one of those, you would peel immediately after microneedling with a specific pre-blended peel and apply a mask which will neutralize the peeling ingredients. The cosmetic needling promotes client comfort and management of downtime. Yes, it will be comfortable. The nerve endings are very deep down within the reticular dermis, which is why generally when you are microneedling, even for a pinpoint bleed, you don't need topical local anesthetics. Using those would prevent you from using any peeling with them. If you are needling for a pinpoint bleed, you wouldn't use a red LED light, for example, for risk of granulation of tissue. So cosmetic needling up to 0.5 millimeter of depth in this epidermal zone, targeting the DEJ, can give you a lot more scope. It will give the client a day downtime. I would treat my clients, ask them not to do anything for the rest of the day, go home, apply more product, don't let the skin ever feel tight, dry, keep it moist, help with the wound management themselves. And the next day they can get up, they can put the makeup on, they can go to work. The redness will have gone. It might be a little bit left on forehead, but other than that, they will be good to go. Obviously, all the other post-care instructions they need to adhere to, such as you don't raise their inner body temperature through exercise, spa treatments, because it would affect the skin. But for popping makeup on, that is fine. So the treatment will improve and reduce hyperpigmentation at the same time, and which is something I'm going to come on to next, and that is treating hyperpigmentation transepidermally and why you should be doing that anyway. So I'm going to explain that a little bit further now. First of all, actually, I'm going to talk about collagen because we've talked about that a lot. Then I'll come to hyperpigmentation. So I'm just going to explain exactly what collagen is. Some of you will already know, but just as a quick recap. So it is a rope-like structure. It's made by intertwining polypeptide chains of amino acids into a triple helix. They have a broad range of functions, including cell adhesion, cell migration, tissue morphogenesis, tissue scaffolding, and tissue repair. Collagens are present in the dermis as fibrillar proteins, and not only give structural support to the resident cells, but they do regulate the resident and inflammatory cell function. All members of the collagen family consist of 3 polypeptide chains, which are held together by interchain hydrogen bonds. I'm just going to show you some pictures now, so that makes more sense. Here we have the amino acid sequence. So branch chain, so proteins that make branch chain amino acids are proteins, and this leads to a collagen molecule, which then builds up into a really strong collagen fiber. And I've just put in brief under there. The collagen fiber molecule and amino acid sequence is the molecular structure. 3 polypeptide coil form to form tropocollagen. Tropocollagens bind together to form a fibril, and these many fibrils bind together to form a collagen fiber. So this fiber that you have regenerated will give you the structure we keep talking about, and that strong network that the skin needs to go from being wavy and wrinkly to nice and dense, like a younger skin. So I hope all that makes sense. So the ingredients for microneedling, taking into consideration everything we've just talked about with collagen, rather than me telling you more about ingredients you all already know about, like retinoids, arginine, matrixyl, vitamin C, I'm going to talk about 3 amino acids. Remember what we've just said about amino acids to the fibers building. So we're going to look at proline, lysine, and glycine. So these are amino acids, and they play a special role in collagen structure. So there's some great products on the market that use these amino acids, and I use these widely in clinic for my clients for age management. So if your skin lacks amino acids, the production of collagen and elastin slows down. So the other benefits of these ingredients include repairing damaged skin, maintaining a healthy pH. So that's what's maintaining a healthy pH. That would lead me to start to talk about barrier function, cell adhesion, keeping the stratum corneum intact, and how that's highly important before you do anything else. You must always ensure that top surface of your client's skin is completely intact to be able to get these greater benefits from microneedling. The PROLINE lightening glycine will kill free radicals, and it will help with hydration and transepidermal water loss. So if we look at PROLINE first, its main function is to produce collagen, what we all want. We're doing age management. It'll restore connective tissue. Your connective tissue is collagen and elastin. It will improve the skin texture. Remembering with clients, as the skin starts to mature, plus 35, it can take on a rough texture. It can start to look thin. It can lose its colour and dullness. So this PROLINE will help with all of that. And it will contribute to the healing process, remembering we've just microneedled the skin. Glycine is a major constituent of all types of collagen and elastin. It'll help with protein synthesis, cell signaling, and it's a great antioxidant. Lysine, again, is an essential amino acid. It helps with protein synthesis, fatty acid metabolism, which fatty acids are highly important in your ceramides as you start to age. It prevents cross-linking, delaying the aging, and it'll harden collagen and the tropocollagen molecules. So those three ingredients are excellent to use not only within your treatment while you're doing the microneedling, but as part of a comprehensive skincare routine for those to use at home. By comprehensive, I don't mean 7 or 8 products a day. I mean specific targeted products that the client will actually go home and do, and they'll all need an SPF. So while we talk about surface, what can they eat? What can they eat to help them with age management and help with the structure and integrity of the skin? So we're back to those 3 essential amino acids, one of which is an essential amino acid. So your body doesn't produce this, you need to eat this, and that essential amino acid is lysine. And you'll get that with meat, cheese, and I've not read them all out, but I've put a list here of essential amino acids containing lysine. And these can be, the client can eat these initially to help boost. And then the other 2 are non-essential amino acids. That means they're in the body anyway. And in most healthy adults, they will have enough stores of those. Now we're on to pigmentation. So let's look at pigment. On the left side, a cross-section of the epidermis. And as you can see from here, we talked about earlier, the predominant cell within the epidermis, as we all know, is a keratinocyte. And then we have this little badger at the bottom, the melanocyte. So when you're treating hyperpigmentation, would you need to go for a pinprick bleed when it's actually at the basal layer of the epidermis? So to break down pigment, you would need to target this zone. So the melanocyte, as we can see on the right, you can see its long dendritic tentacles which work up. And what happens when with melanogenesis is the UV rays come down, they trigger some enzymes, tyrosinase, and these will build the melanosomes up with melanin, and these will work up the dendritic arms, dock at the side of a keratinocyte and literally spill the guts and drop that melanin within that keratinocyte cell, leaving you with the tan. And when that goes a bit wrong, that leaves you with patchy hyperpigmentation. That's a really quick explanation. So that's what you're going to be targeting transepidermally with a no blood treatment. So what is hyperpigmentation? As I said before, we're not looking at melasma, it's very different. So whilst hyperpigmentation, as you'd all be aware, is tan, light brown in colour. Melasma will be a blue, blacky, grey colour. It is speckled in appearance. Melasma will be a block appearance. If you're to use a Woods lamp, this pigment will become enhanced, and all that pigment that's a little bit lower that you can't see with the naked eye would show up under the skin. So a wood lamp's a really, really good old tool, but great tool to use in your consultations. Melasma will look very dense and with regular borders under a Woods lamp. So it's great to be able to determine the two. Whilst a lot of people can have both, you would need to understand the difference to not be able to tell them you're going to be able to treat something you can't, because melasma is a dermal issue. So what triggers pigmentation? Yes, we know UV does, but trauma can as well. And you'll see this in a lot of clients after they've had any acne and any spots, and they can leave their mark behind. Can get it with animal bites or stings, burns. People who've had plasma and it leaves like a brown stain behind, that's post-inflammatory hyperpigmentation. Genetics play a part in pigmentation, and UV damage. Normally you don't see UV damage, well, you never used to until people were late in the 30s. But sunbed seems to have somehow made a big comeback, and I've had some younger 20 clients in the 20s with UV damage, and I would say 80% of the time I've not been willing to treat them with microneedling devices for the wound healing response, the downtime that you have and the management that's required, because if you're going to microneedle to treat the hyperpigmentation, are they really willing to stop going on a sunbed, or is this something you need to do when they're willing to? Medication plays a part in hyperpigmentation. The big one being contraceptive pill, topically using steroids. So you'd always thoroughly ask what medication they've been on, historically what medication have they used orally or topically. See if this is an indicator to their hyperpigmentation issues. Some pills can make pigmentation come up on the back as well. Lifestyle factors must be considered at the time of consultation. If your client tells you they are active, walking, running, horse riding, all outdoor activities, is this something you want to do in the summer, or is this something you want to be doing more in the darker months with being in the Northern Hemisphere, October onwards? Do they swim? Are they going to stop swimming after treatment for at least 72 hours? Just speak to them and find out what their lifestyle is, what's triggering the pigmentation. You can treat all hyperpigmentation, but if it's not managed and treated accordingly to their actual consult and their lifestyle and their medical history, it will come back. It must always be maintained and managed. So your treatment considerations, the big one is post-inflammatory hyperpigmentation, especially with Fitzpatrick types 3 and 6, and anybody with existing hyperpigmentation concerns, including a Fitzpatrick 1 and 2. So Fitzpatrick skin types 3 to 6 and a hyperpigmented 1 and 2 must always be on a tyrosinase inhibitor. Okay, so that is the enzyme which triggers the melanin production. They're prone to post-inflammatory pigmentation after skin treatments. So not only IPL, laser, chemical peels, microneedling, they don't like the circulation will cause the inflammatory response is quite aggressive. So you need to control all that so that you don't cause more of what they're trying to treat. You don't want to give them more pigmentation when you're trying to get rid of it. So this needs to be done before and after treatments. So the preparation of products for a skin type 3 to 6 will be required to use products much longer than a phototype 1 to 3 skin type. So when somebody comes in for consult, you want to not only look at their Fitzpatrick, their lifestyle, their parentage or their genetics, and make a decision. How long do I need to control this melanogenesis and the pigmentation response. And so somebody with Fitzpatrick type 5 and 6, you might want them to use tyrosinase inhibitors for a month to reduce that risk of post-inflammatory pigmentation. If somebody is a skin type 1 and 3 and they've got quite a lot of hyperpigmentation, if you start to control with the products a couple of weeks before treatment, then you will be able to get a much better and safer response, and you would have the mindset of the client to carry on this between all the sessions that you're going to do. So the main ingredients we'll look at for controlling hyperpigmentation: vitamin C is great for anti-aging, it's great for acne, rosacea, and pigmentation. So it does suppress melanin synthesis in the melanocytes. It will reduce the amount of pre-existing melanin, so it's going to kill off what's already there. It'll promote the collagen synthesis by the fibroblasts, so that's great for anti-aging. And we know that it'll help with free radicals as well. So that'll keep your cell longevity going for longer, keep them intact. And it can help with reducing the destruction. It has a gradual vitamin release. So vitamin C is a really prickly ingredient, and it's encapsulated in glucose. So that when you put your microchannel in, or you pick chemical peel, and the ingredient will go down to the targeted area that you need it to work on, and then the glucose will dissolve, so the active ingredient can work at the site you need it to, rather than all being lost on the epidermis, on the stratum corneum at the top. And they're usually in dark packaging for this reason. So it will act as a free radical inhibitor, reduce any irritations, give them that nice glow, and reduce wrinkles at the same time. Another great one, fabulous ingredient, is niacinamide. All your vitamin B3s are great for, not B3, all your B vitamins are great for the skin. So it's an effective skin lightening compound. This will inhibit the melanosome transfer, so it comes a bit later than the vitamin C. It will interfere with the interaction between keratinocytes and melanocytes, inhibiting melanogenesis. It will reduce pigmentation by disrupting the action of one of the key enzymes, which we spoke about, tyrosinase, required for the production of further melanin. It's really, really great for reducing redness and inflammation, niacinamide. So if you are working on acne skin with post-inflammatory pigmentation, this is a great ingredient to include. And I like to use it with my rosacea clients as well, to help strengthen the capillary network and reduce the inflammation and the flushing. So it will help prevent melanin production, niacinamide. Arbutin, it is a widely prescribed skin lightening and depigmentation ingredient. It's a derivative of hydroquinone. Arbutin is definitely a cosmetic ingredient, whereas hydroquinone is a medical ingredient which will be prescribed. It's good to remember at this point that no products on the market are medical unless they are given via a prescription. They are cosmetic. It is a naturally occurring plant-derived compound found in the dried leaves of a number of different plants, including bearberry, blueberry, cranberry. It's also missing on their mulberry. That's another good one. Phytic acid and gallic acid. And it'll inhibit tyrosinase activity, inhibit the melanosome maturation, and it's less cytotoxic to the melanocyte than hydroquinone. So its efficiency is thought to be a little bit safer. And they have shown that arbutin's less effective than kojic acid. Kojic acid is another great ingredient. I like it. It has a dual effect. It's great on hormonal acne. It's great on acne. It helps break down pigmentation. So kojic acid is a lovely ingredient to get in people's skincare routines. But arbutin has been shown to be less effective than kojic acid. But on the flip side, it does have its own really good benefits. Time frames. So again, same as aging. You can treat your clients 2 to 3 weeks apart. They've maybe done 2 to 3 weeks home care, pre-treatment. Your treatment will be no blood, doesn't need to have blood. The melanocyte sits within the basal layer of the epidermis. You can use superficial pre-treatment. You can combine with LED. I wouldn't start combining willy-nilly with other treatments, and I would stick to manufacturers' protocols at all times if combining different treatments. Don't make your own up. Always use with appropriate topical actives pre and post treatment to control that melanogenesis process to help break down the pigment. They will need to continually use ingredients to help stop that process to get the best results. And then once you've treated the pigmentation, you could work on more relaxing therapies, more holistic facials. You could do natural facelifting treatments, Casey. There's many things you could go on to do whilst always implementing the maintenance of pigment. So I think I'm about out of time at this point, but I did want to touch a little bit on acne. As therapists, we would always work on acne type 1 and 2, so your comedones, all impacted comedones. And at the moment, I don't know how you guys are, but I know when I returned to work in August, mid-August, everyone came back with lovely skin. Then they introduced compulsory mask wearing, and I had a whole set of different clients return. They had loads of congestion, dryness in these humid bacterial environments. So acne at those lower stages, I would be treating at this time every couple of weeks and give them comprehensive products to use at home and really clear out that pilosebaceous unit to help remove the bacteria, give some oxygen back to the follicle and allow for the efficiency of the skin to work. Always bear in mind how often they're wearing their masks. Is microneedling going to be the best option you've got, or do you have other things in your arsenal that could be wisely used at this time? So thank you for listening. I hope you've managed to take something away from today. And if you have any questions, I will be able to answer them now. I will just put me and Eve back big when I figure out how to do it again. Hi, Eve.
Hi, I'm back. I think I can, oh, here we go, I'm back. We've had actually loads of questions while you've been chatting, which is great. I think we've also had loads of comments saying this has been really useful, amazing talk. So thank you, Jody, it's been fab. I think really educational, really in depth. So lots of appreciation, thank you.
I try to make it as brief as possible because you can go down a rabbit warren when you start talking about certain things.
Yeah.
But anyway, I hope I can answer your questions.
So yeah, tons of questions. Hopefully we can get through them all. I will start with, we've had some through Zoom. We've had lots of people watching live in the Zoom platform, which has been great. And we've had lots in here. So one that we just had recently was the ingredients that you just mentioned. Are you suggesting these ingredients are needled into the skin or applied afterwards?
Yeah, it is both. You'd need to look at the different manufacturers of these products. And the ingredients I've mentioned, they are used within different manufacturers' protocols for popping into the skin. I think when microneedling first came about and became a little bit more cosmetic, everyone was just slapping hyaluronic acid on. And hyaluronic acid is a great ingredient. It's one of your glucosaminoglycans, so it will help with stimulating fibroblasts. And I'm sure people know, but hyaluronic acid is one of those highly marketed ingredients that's mismarketed. And for active ingredients to get within the skin, they need to be of a molecular weight, a kilodalton weight, low enough to actually have an active response under the skin. So some of mine hyaluronic acids, say of a kilodalton weight of 1500, there's no point in me injecting those. I need to be using something really small, like a 150 kilodalton, to be able to have an active response on the growth factors. If it's a higher weight of hyaluronic acid, that's there to sit and film form, which is perfect for people that are suffering with high dehydration.
Fabulous, thank you. Gosh, tons of questions still popping up. So Lots of people initially, actually, let me just cover this, are asking, can they watch this back? Because some people say I missed the very beginning, or do you want to scribble it all down? This will be available on our Facebook page if you're watching in Zoom. If you want to go
to put the what do you call it, a PowerPoint in a PDF.
That would be amazing. There's lots of people that have asked, can they get the presentation afterwards? So depending on your thoughts on that, Jodie, if you're happy for us to send it on to them, we can certainly do that. So if anybody does want the presentation, if you drop an email to info@professionalbeauty.co.uk, then we'll get that sent on from Jodie. But you can watch this back on Facebook. So if you go to facebook.com/professionalbeautyuk, that's our page, and we're streaming live there, and it will be available afterwards too. So yes, lots of other questions. Lots of people are asking, when you're talking about peels, do you peel before or after, or does it depend on the peel? And how long before would you do the peel if you're peeling before?
Sometimes it depends. It's always client dependent, so you must take this. Well, I'll explain, and then you'll know, you think, oh, that'll not be right for that client. I generally, when treating before microneedling, I do a lot of prep. If I don't just get a client in, consult, get on the couch, let's do your microneedling. It's not that sort of treatment. So I'd always have pre-care before, and I would always ensure that the barrier function of the skin is completely intact and functioning before we do any sort of treatments like peeling or microneedling. And generally, I would use a peel which is in line with the manufacturer's instructions. They usually contain mandelic acid. Mandelic acid is a fabulous chemical peeling ingredient. It's a large molecule. It's the largest molecule there is for chemical peeling, where glycolic acid is really, really little, so it goes straight in. So anybody with an impaired barrier function, that's going to feel like fire, like your face is a Bunsen burner, whereas mandelic is nice, small, and will slowly work on the surface of the skin. And it just does that nice exfoliation, working very superficially, but it'll help with pigment. It has an antibacterial effect, it has an anti-inflammatory effect. So the manufacturers that I use tend to have high rates or pure mandelic acid in there. So whatever you do, don't start microneedling and stick somebody a glycolic peel on, or even a lactic acid peel. It's a hydrating as lactic acid is. It's I know it's a milk derivative and it's a lot calmer, but it's still quite a small molecule, and its pKa is quite different to a mandelic acid.
Excellent, thank you. And also, lots of people are asking which products you use. Can you recommend? People are asking either about
what I use, and then you can do your own research, and will lead you to your own choices. So I use Inner Aesthetics for micro needling, and they do have a pre-peel. I'm still quite limited what I use from Inner Aesthetics. It is a medical range, but they have some fabulous ingredients. One particular one I use a lot is from Juliette Armand, Mesotech, which is a purposely formulated cosmetic needling, and that uses a mandelic acid and microneedling, which you can do weekly for the depths that you would be needling at, and do over 6 treatments. And they have some great ingredients in there, like matrixyl, which is fabulous for working on your tetrapeptide 8 and helping with the cell function. And I use dermaceuticals, which has appeal to use after microneedling. And I use a couple of others as well, but we'll stick with them 3.
Brilliant, thank you. A couple of other people have asked about equipment. Someone has asked, I've been wanting to get a good LED unit, but I want to find a proper safe one I can trust. Where should I look? Should it be FDA approved?
Well, we're not, I know people talk about this a lot in the UK, but we do not come under the FDA. Whilst it's a good indicator, we need to look at EU regulations. I've looked at LED, it's not something I use within clinic. I feel a bit, I'm definitely a therapist at heart, and to leave someone sat under there for 15 minutes with what I feel is not great gains, it's not a treatment for me. I have researched them, and I liked the Soluma light, and I also have a few of my colleagues within industry, and they all really, really like the Dermalux Flex. So I would look at those 2. I've used the Soluma, and I did like that. I've not used the Dermalux.
Excellent. Thank you. We've also had a question about, is there a derma pen that you could recommend? Again, what do you
There's loads of microneedling devices. I like DermaPen, obviously, and then I do like, which I have been looking at, is Biotherapeutica have got a BT Titan, and that's a American company. They are FDA approved, and they have a medical one and a cosmetic needling device, and they are lovely. And that's because we've been a BTCT centre, and I've got a few different devices, and that's definitely, I'd have a look at that. That's a really good contender, and it's a good price. The needles to rebuy, consumables are a good price, and it's a nice company too.
Excellent. Just to cover one or two of the questions from Facebook, somebody there has asked, how many sessions can you have done in a year? I guess, yeah, how long would you leave between sessions?
Cash is just asking, name of the LED, Soluma and Dermalux. And originally with microneedling, when we first started and used to put topical local anesthetics in everyone for half an hour and then needle them willy-nilly to not 1.5 mil, and they'd have a week's worth of downtime, you'd do 6 in a year and then maintain. Whereas you can safely microneedle transepidermally through a course of treatments and then do your maintenance sessions much closer together, which is how I work, and there's no risk of granulation of tissue as long as you are not inducing a pinpoint bleed. But again, with microneedling, if you're needling for a condition and the indication is controlled, you don't just keep microneedling, you maybe bring in some superficial peels or different treatments that you've got.
Great, thank you. Lots more questions. Perhaps we'll just do a couple more because I know we are coming up to time. But interesting one we've had here is, which ingredient would be the best to target stretch marks safely on darker skin types?
If you're working on darker skin types with stretch marks, I would rather treat a stretch mark if it's not silver. It's limited, and I would think you need to do that with PRP personally. But if they are quite fresh and have colour in them, I would, rather than try to needle to put in, say, artichoke or something like that to treat the actual stretch mark, I'd be needling, using the needling side of the treatment for the work on the scar. And you do need blood, unfortunately, in stretch marks. You do need blood droplets rather than pinpoint bleed. And I would use hyperpigmentation controlling ingredients to reduce the risk of causing inflammation, especially in a higher Fitzpatrick. That would be maintain that melanin response. Your needling will do the scar.
Excellent, fantastic. I think we've covered most things. I'm sorry if we didn't get to your question. We have had tons, which has been really great to see. And as I say, lots of people just saying thanks so much. It was really, really informative presentation and Q&A. So thank you so much, Jody.
Oh, good. Thank you very much. I hope everyone's enjoying and all excited to go back to work. I can't wait to see the clients.
Finally.
Thank you.
Thank you. And as we say, if anyone does want to watch back, if you go to our Facebook page, Professional Beauty UK, you can find the presentation there. And if you did want a copy of the PDF of Jody's slides, drop an email to info@professionalbeauty.co.uk and we will pass those on. But thank you everyone for watching, and thank you so much, Jody.
All right, thank you very much.
Thank you.
Have a nice day.
You
Bye.
too. Bye everyone.